Welcome to this presentation. My name is Leo Visser and I am a professor of infectious diseases. According to the ECDC, migrants are individuals who temporarily or permanently live in a country different from their usual place of residence for at least a year. Generally, migrants do not pose a health risk to the host population. However, some groups of migrants, such as refugees, asylum seekers, and irregular migrants, are particularly vulnerable to infectious diseases and may have worse health outcomes than the host population. Before travel or upon arrival, most asylum seekers will be screened and, if needed, treated for highly contagious diseases such as tuberculosis. During transit and at their temporary accommodations, this group of migrants will receive immunizations to prevent outbreaks of infectious diseases such as measles. After settlement, all groups of migrants will participate in the regular health system. In this video, we will focus on parasitic infections that may arise during settlement. We will not discuss TB, viral hepatitis or malaria. After viewing this video, you will be able to understand why specific types of infection occur in specific risk groups of migrants. Based on a single example, you will learn to recognize some major clinical symptoms related to a parasitic infection. Let's first look at an overview of the main routes of northern migration in the world. For this course, we will focus on the European Economic Area. Numerically, most asylum seekers are coming from Syria, Iraq and Afghanistan. However, regular and irregular migration of northern and western African nationals along the central Mediterranean route is also substantial. In addition, we see ongoing migration from South and Central America, including the Caribbean, towards Europe, in particular to the South European countries. And there is also a flow of economic migration from East European regions towards the relatively richer countries in the West. Now, knowing the country of origin of the migrant and the route of travel is important information for estimating the likelihood of a certain disease. Certainly among newly arrived migrants, the prevalence of infectious diseases tends to reflect the prevalence in their country of origin. Parasitic infections may have been acquired in the country of origin, along the migration route, or at the country of destination. In general, protozoal infections and ectoparasites present in the first weeks or months after arrival, whereas more chronic helminth and some protozoan infections may present months or years later. However, as you can see from the table, it's difficult to provide exact time indications and there may be some overlap. The clinical presentation of an helminth infection is highly variable, ranging from mild abdominal discomfort to severe septicemia. In general, one can distinguish three main categories of signs and symptoms: abdominal pain, itchy skin rash, and eosinophilia. Eosinophilia may or may not be present depending on the level of tissue exposure to parasite antigens. In the remaining part of this video, we will discuss a typical presentation of a parasitic disease. Let's listen to the story of Miss Suku. Miss Suku is 40 years old. She was born and raised in the capital city of Suriname. As a child, she used to frequently visit her grandparents, who lived in a rural area. She enjoyed playing around on their farm. She has now been living in the Netherlands for almost 20 years, and for some years now she developed an itchy skin rash near her buttocks. It comes and goes, lasting several hours at a time. Her GP has prescribed a steroid ointment, but its effect only lasted a few months and then it returns. During the last 4 years, she has experienced discomfort in her belly. Stool examination was ordered by her GP but turned out negative. He did mention that the number of eosinophils was slightly elevated in her blood tests. Unfortunately, her asthma has worsened recently, and she's taking prednisone 30 mg per day for 2 weeks now. Her abdominal complaints tend to increase and she has loose stools now. Today she has a fever. So let's try to analyze the complaints of Miss Suku in more detail. The complaints of itchy skin rash, abdominal discomfort and eosinophilia are highly suggestive of a helminth infection. The timing of the complaints is years after being exposed to rural Suriname. There's only one helminth which is transmitted via contact with contaminated soil, which can survive in a human host for so many years, Strongyloides stercoralis. Finally, the complaints of worsening during treatment with prednisone suggests an exacerbation of the infection. So what have we learned in this video? Most chronic parasitic infections in migrants present months to years later and reflect the prevalence in their country of origin. Abdominal discomfort, itchy skin rash and eosinophilia are highly suggestive of a helminth infection. Especially in the case of a high tissue exposure, eosinophil counts may be elevated. Strongyloides stercoralis can survive in a human host for many, many years. During this course, you will be exposed to a number of patient cases. All the cases concern migrants who came to the European Economic Area for some months or years before presentation, and they have all suffered from a chronic parasitic infection. You will learn about the clinical presentations of these infections, the possible risk factors, and route of transmission. Finally, you will discover the diagnostic options and the best possible treatment policies. Thank you for watching this video.